Hi, my name's Randy, Chief Technology Officer of VDI Laboratory. In this presentation, we're going to talk about therapeutic monitoring. So there's two types of therapeutic monitoring that I would like you to consider. There's one where we're removing the tumor itself. So it's post-surgical metastatic disease. So an example of that might be grade 2 mast cell remover or a splenectomy. In this situation, we know that we're removing the tumor, hopefully with clear margins, and the therapeutic surveillance of testing would then help tell you whether or not you have any disease recurrence or not. The other is lymphoma. Now, classical lymphoma, of course, is that you're treating with some regimen, chemotherapy or otherwise, killing off the tumor, and then hopefully moving it into a remission status. And then what you're trying to monitor then is disease recurrence. So let's examine that a little bit more closely. Now, the two markers that we're going to talk about in this regard is thymidine kinase type 1, a DNA proliferation marker, a marker of dysregulated cell cycle growth. This is our standard cancer marker in the services that we provide. And then inflammation, because cancer is an inflammatory disease, we're using canine-specific CRP and feline-specific haptoglobin. Right? And I'd like to introduce another concept to you. That is, time is a biomarker. So, of course, we're measuring TK1, we're measuring CRP or haptoglobin, but an additional thing that we're getting is the change of time. And if you think about your patient and you're taking multiple measurements along the way, you are in essence creating what we like to term a diagnostic movie. I mean, you literally are. You're watching things change over time in response to whatever it is you're doing. If you got a medication, you're pulling back that medication. They come down with, a sickness of some sort, and then you're actually watching how things change, and then whether or not, cancer might be recurring or some other process might be occurring. And so by looking at our two markers, a DNA proliferation marker and an inflammation marker, why are these effective? Well, if you think about medication and what they tend to do, they're killing off the tumor, hence reducing tumor burden and growth, i.e. proliferation. It goes down. And for sure, they're always knocking out inflammation. So these become very useful markers in this regard. So we do this for you. So when you send us multiple samples, we automatically chart it for you. There's nothing more you need to do. You even get a discount doing this. And here is the abnormal TK line, and here is the abnormal CRP line. And it's a very simple goal. You start up elevated because it's positive, you got cancer. You start treating, and the goal is to get below the dotted line. Black below the black dotted line, red below the red dotted line, and that's where you need to be. And this would be a classical lymphoma case because you're killing it off. It's not an immediate drop, you're killing it off, and it goes down over time. If we take a look at these two specific reports and compare and contrast them, it's a little bit better to understand. On the left-hand side over here, we are looking at what might be like a solid tumor excision, like a splenectomy or something of that nature. Initially, it was elevated, and you can see that at time 0. Then it's removed, it's cut out. Now, the tumor has been removed. Therefore, the source of TK, the source of inflammation, post-healing, has been removed. And it immediately then drops below the dotted line. And that's where we want it to stay. We want it to stay below the dotted line. Now, this one did not. It popped back up, which means that we have disease recurrence, metastasis. And then further treatment was given, and you can see that it drops. What VDI does is that will give you information about what's going on. Time is a biomarker. So you can see here, 2 or 3 data points going down means that things are trending down. In this case, everything's going good, it's trending down. On the one on the right, it's trending the opposite. You can see that things are going up. It's trending up. The TK1, you can look at it right here. It's going up. 4 data points going up. So it's telling you that it's going up. On the CRP, there was a significant change. It went from normal to abnormal in one shot. So that's a significant change. And this would be a classic case of a lymphoma case. So you're killing it off, it drops down, and then it goes up. And you'll notice on CRP or inflammation drops fast, because it always does. It stays there, and it's one of the last to rise. TK is almost always the first one to rise. And this is what we call the hockey stick. So it sort of goes down and up. And both of them experience it, but the hockey stick on CRP comes up a little bit later. That's all. And the program is designed to sort of follow all this information and then tell you in the interpretive comments exactly what's going on. And that is why this is very powerful for context-sensitive therapeutic monitoring. So here's an example of effective therapy. Okay, it goes down, it starts high, works its way down, and stays below the dotted line. Okay, here's the black dotted line. Inflammation drops, stays below. Effective therapy. Ineffective therapy. So inflammation drops, it always drops. If even you just give anti-inflammatory medication, it's going to drop. But you'll notice that TK did not go below the dotted line, which means that therapy was completely ineffective, which means this would warrant a change in therapy to then get it down so that the proliferation isn't occurring. And then this would be the standard hockey stick that we often see. It goes up like this, and this would mean disease recurrence. It goes down, maybe it stays down for quite a while, then all of a sudden, boom, it comes back up again. And usually this rise will happen precedes any clinical signs, particularly TK. TK, and especially in lymphoma, because it makes a lot of TK, will precede anywhere from 30 to 60 days in advance of any clinical signs, and hence something then for you to take more earlier action on appropriately. Now, here's an example of an indolent lymphoma. So, why is it effective for there? Well, indolent, you just basically want to make certain that it stays low. And this one did. You'll see the black just stayed below the dotted line. You did see one elevation here for CRP, but not in a corresponding TK TK value. So that means there was an inflammatory response not associated with TK. This was an indolent patient. This patient happened to get admitted to ER for heat exhaustion, and had nothing to do with cancer. It went back down after being treated. And then, of course, this patient remains fine, just being monitored for indolent lymphoma. This would be your typical multicentric B-cell lymphoma case where it goes up, it goes down, and then here's the hockey stick, it goes back up again. On this particular patient, there was a positive response to therapy. Then the trending occurred, so it started low, went up. You'll notice CRP, again, it lags a little bit behind the TK, very common. TK is usually the first one to pop. Then a change in therapy was warranted, and now the patient's been brought back into remission status. So this is an excellent use of this. And this was a splenic hemangiosarcoma. Now, there was no time zero in this particular case. This was post-splenectomy, so it was already low. You can see that. Both of them low, although inflammation was a little bit elevated right here. Maybe it was a little bit too soon in this particular case, post-healing, but then it did, of course, drop down. But then notice what happened. You can see that both TK1 and CRP jumped. Now, look at the time difference here. This was February in 2022 and then September of 2022. And that's a lot of months. So if you wait a long period of time, it becomes history. I mean, that's all it is. You're just basically documenting history. If you want this to be useful for you to manage the case, then we recommend about 4 to 6 weeks, like monthly, basically, in order for you to get it. Now, if this was done more frequently, you could have clearly seen that something would have been popping sooner, and then action could have been taken much sooner for this particular patient rather than looking at after it already crashed. So with lymphoma monitoring, TK1 and CRP trend down with effective therapy. So if it's effective, it will drop. If it's ineffective, it doesn't drop. CRP is always the first to drop. TK1 basically is the first to rise. That's just always the way it happens. So you can see CRP first to drop, CRP last to increase, and vice versa with TK1. It is the classic hockey stick and something that we use to see all the time in these lymphoma cases. So it is useful, especially in as a diagnostic in untreated patients, of course, and then following it on for therapeutic monitoring. So I always recommend, even if you're doing like an FNA on a lymphoma, for example, you get a baseline pre-treatment TK1, because then it becomes very helpful in managing that patient later on. TK1 is always the primary marker and is always the first to increase when disease recurrence happens. All of our little significant change markers are at a 40% from prior indication where it goes up. And that is a significant finding that we have determined. We do recommend monthly testing, because if you go longer than that, then it just becomes a history lesson. That's all it is. Medication, whether it's traditional or holistic. I get this question all the time. Well, I'm giving holistic medication. Does it affect your markers? Well, why are you giving holistic medication if you don't believe it's actually going to infect the markers? You know, I mean, if it's going to affect the disease, it's going to affect the markers. And so, yes, many holistic, natural types of therapies actually works really quite well. We see it all the time. If the TK1 is being affected by the medication, so if the medication is truly anti-proliferative, it will drop only if the medication is truly effective. So there's no 2 or 3 ways about it. If you've got effective medication that's against the tumor, arrest tumor growth and proliferation, TK1 will drop. End of story. So I thank you for your time. I hope you find that therapeutic monitoring might be something that's suitable for your clinic to practice.